We are, of course, as always, really excited to bring this type of an event to a group of people. It's actually my preference that this be a very intimate group, so I'm rather pleased with the size of this particular group. I'm just hoping that you're all going to be very participatory in this dialogue. This is really about business leaders in the community, i.e. you, being part of this discussion and asking the questions that I suspect are burning inside of you as they have been inside of me. So obviously we know that the healthcare reform bill has garnered extensive controversy. We know that people have questioned its effectiveness. We know that people have certainly questioned whether or not it's going to affect their business and how it's going to affect their wallets. But regardless of the position that a person has taken, the bottom line is that bill has passed. It is a law, and it is happening. And so it's no longer a question of should we or shouldn't we do this. Done deal. At this point, we're moving forward and saying, okay, now what? What does it mean? This thing is thousands of pages long. What does it mean to my company? What does it mean to me as an organization? How does it affect my employees? How does it affect my bottom line? The implications of this law are extensive, and I think I speak for most business people when I say it's a paradigm shift that we don't know what to do about, and it is something that has become, even for the smartest business people, a true conundrum. So we decided, given those questions and the amount of interest, that we would pull together a panel of people who we are going to call experts for the sake of putting them on the spot. Although I do feel it's only fair to, hey, it's a really new thing, so to say you're an expert when it just came out and it's a couple of thousand pages long, you know, let's be a little fair to these people. But certainly, as opposed to most of us, these people have quite the handle on this subject, and hopefully, if we're doing our jobs correctly, they're going to have some answers to some of these basic questions. I will tell you that I did a lot of reading on this in order to get to sit in the seat. Scared the bees out of me. I was petrified to do this event because there's so much knowledge to learn. Let me introduce, first of all, the panelists so that we know who we're talking about and who these people are. I'm going to start that way. So Ken Hunter is the Chief Operating Officer of Kaiser Permanente. I don't have anything else to tell you because everybody knows what Kaiser Permanente is. He's the Chief Operating Officer, he's the guy. Randy Haught is the director of the Lewin Group, and that is a subsidiary of the United Health Group. Randy is a subject matter expert on healthcare reform. Am I doing that in the right order? Are you Randy? Oh, dude, you switched seats. See, I told you. Did I? Okay.
Second seat.
All right, that's Randy. I completely screwed that up. Okay. Bill Robertson, I know that's you. Okay. Bill Robertson is the president and CEO of Adventist Healthcare. Oh, there's that name, dude. Okay, ready? Gaurav, thank you. Dr. Gaurav Dale, right? Okay. And he's the Chief Medical Officer of Adventist Healthcare. Bob Bender, that's you, is a CPA with the accounting firm of Aronson & Company. Bob specializes in healthcare reform and its financial implications on business. So everybody's going to kind of go talk to us. And of course, there's Jay Belden Young. Did I say it right?
Yes.
Good. And he's a consultant with Flack Ventures. Jay specializes in employee benefits and insurance with expertise in the design of health plans. So hopefully this panel is a nice smattering of information. So as we ask our questions, whoever feels that they can answer it best is going to jump right in. So please jump right in. It was also never my intention to have all boys, but it looks good for me. I'm just saying. I'm just saying. I definitely am the pretty one at the table right now, so that works out better for everybody. Okay, so I did do a lot of reading. So I'm going to open up the conversation again by stressing to you that I am more confused today, having read so many different things on the healthcare reform plan than I was when I started, because I thought I knew a little bit. And as I read and more and dug, I found I had a lot of contradicting messages, and who knows what's a fact versus what's an opinion, and what does it really mean, and how does it, and you know, especially when I'm digging for specifically about business, what does it all mean? So I'm going to start with a two-part question, and just jump, because I don't know which one of you can answer this the best, or maybe all of you have a different opinion, but here's the most basic question I could possibly come up with. With this new law, will all employers be forced to offer health care benefits to their employees? Second part of that question is, what about the unemployed? Do they have to be insured, and how does that work? Who wants to jump in on that question for me? Bob? Have at it.
So the first part of your question, all employers having to offer, the way the rules are now written, and obviously there's going to be a lot of years of opportunity to adjust. Starting in 2014, all Americans have to have health care. That's the bottom line. All Americans citizens, residents have to have health care. Employers with 50 employees or more, the onus becomes that employer's responsibility. And there are penalties for not doing so. But as I say, between now and 2014, there's some opportunity for some adjustment. But to answer your question, the smallest of all employers are not mandated to have a health care plan. And in fact, which is not exactly your question, but just to throw this out, those small employers are the ones that have the tax benefits that have been added to the new rules, which employers heard all about, but really apply to only very, very small employers. And second part of your question was?
Well, did you want to add something to that? I thought you were kind of saying you wanted to add anything. No, you're good? Okay, you were agreeing then? Okay, does anybody not agree with the go ahead.
No, I can jump in on the individual mandate, which is the most controversial, right, part of the
you guys try to talk into the mic for me, thanks. Yeah.
The second part of the question, I think, was around the individual mandate, the requirement on the individual side, which, as I said, is the most controversial part. That's where the lawsuits, most notably for us, the Commonwealth of Virginia, is pursuing, whether that's constitutional. We'll see how that goes. The law.
Could you expand on that just a little bit? I don't know that everybody. I know I don't know any. What are you talking about?
So what many states, led by the Commonwealth of Virginia, have asserted is that the individual mandate, essentially the federal government's ability to force somebody to buy something, is a question about whether that's constitutional. I think under the Commerce Clause. I'm not a lawyer. Somebody else maybe can expand on that, but. And so that's an open question that I think will probably go all the way to the Supreme Court, I would guess, and probably play out over, at least a couple of years, I would think.
So the question of whether or not every person, unemployed or employed, will have to be insured is right now in law, but questionable.
Yeah, now, so how does the individual mandate work? It's like many things in the bill, including the employer issues, it's a 2014 trigger, so it doesn't really impact until 2014. And it's a combination of you have to have coverage, or you pay a tax penalty, essentially. So it's the or that's really the key. The issue for many of us, and I'd be interested in some other comments, is that many in the industry don't see that the penalty is high enough to be an incentive for certain people at certain income levels. The incentive, I made some notes here, I think it's like $300 a year or 2% of income. So obviously as your income gets really high, makes sense. Buying insurance will make a lot more sense if your employer doesn't provide it than paying a penalty. But $300 a year isn't very much, as we all know, relative to what health premiums cost. So many in the industry kind of refer to the individual mandate as a soft mandate. Sure. And so there is an open question about, will 100% end up being covered because of that issue? I don't know what others think.
Yeah. Go ahead, please.
Yeah, well, actually, I think it's about $700 a year once it gets in.
Yeah, once it's fully phased in.
And up to about 2,000 for family. But I mean, the key piece of it is there's so many pieces that are intertwined in this. If one thing falls apart, the whole thing starts to unravel. The key thing on the individual mandate is that now insurers have to guarantee issue health insurance at a community rate. If we don't get everybody into the system where they could come in whenever they wanted to, they could really wait till they got sick to purchase health insurance instead of having it continually. And that's, of course, contrary to the way we've always operated health insurance.